Hello, this is Dr. Lenz of Longevity Health Institute. As I sit here in front of our core values, and yes, this is what we truly live by, breathe by, hire by, fire by, and love patients on and heal patients on, are our core values. But one thing here is improve the quality of life for all. I had to really have a heart-to-heart talk with a patient today about cardiovascular health because he does all these wonderful things for prevention and longevity and energy and looking good and feeling good and lifestyle stuff, and he's really dialed in there, but he was kind of putting his head in the ground in denial, I'll just say, about his cardiovascular health. And I wanted to share with you a little story about something and how I explained this to him about how we can really deep dive into your cardiovascular health, because the reality is we make no improvement and no difference if we make you energetic and feel good and thrive and do all these wonderful things and have love and joy in your life and good mood and good sex and on, but you have a heart attack, or we're not thinking of you long term in decades and you end up with a stent, or God forbid bypass, or God forbid 50% of the first symptom of a heart attack is death. So we have to think like this, okay? Not just put fuel in the gas tank. So this gentleman actually had a few years ago, not a horrible cardiac calcium score. Obviously 0 is ideal. A CT calcium score looks at calcified plaque, typically hard plaque in the endothelium, in the vascular wall, and in the lumen of the arteries of the heart. And that's the way you assess essentially disease. And it is probably the most revolutionary thing for screening in cardiac health. At least that's affordable, very easy to do, and out there. And yes, I have to have this discussion with people. You're trading radiation for information, but sometimes that information is very critical. And why is because especially middle-aged men are getting into their 40s and on, is that cardiac health and cardiac risk is really common and often undetected and often underappreciated. So this gentleman, though, he had minor calcified hard plaque from his past CT calcium score. And what I wanted him to do is get a CT angiogram. And he was really reluctant on that. Well, what's the difference? Well, CT angiogram is going to be a little bit more detailed. They're going to give you an intravenous dye. They're going to give you a medication. Even if you're wonderful, by the way, health, and your blood pressure and heart rate are very low, they're going to give you a beta blocker, a medication just temporarily. It affects you for about 6-8 hours, where it slows down your heart rate. And the reason they get better images and better perfusion of the quick intravenous dye they give, so that they can see the heart and get really good technique there. So very simple. The test takes literally minutes, and it's very simplistic to do. Depending on your risks and all that, it can be insurance covered depending on history and all that stuff. And if it's not, I think cash pay is about $500 to $700. But when you find you find something there, then there's AI. And AI is, scary, but a wonderful thing that we're embracing in medicine and in the world right now. And one of the things that AI has given us is software called Clearly. And Clearly really helps us then assess when somebody is got a CT angiogram or got some blockage, but it's not really, what do you do with it? And how significant is it? Are they really at risk for a heart attack? And can we modify them, and really look at this. Now, of course, there's all these metabolic and cardiovascular labs we do and genetics and all that, but I'm talking just about imaging right now. So doing the right thing, living by our core values and really helping all, we got to think of these things. So in this person, I ordered this test. Well, let's assume that a CT angiogram comes back with a 20-30%, maybe even a 50% on one or two of the arteries, maybe the circumflex artery or the LAD, which is called the widowmaker, or the main coronary. But let's say it says that, okay? Well, without symptoms and risk modification, that could be a stent. It could be medical modifications and lifestyle modifications and medications and things like this, supplements, etc., diet, etc. But it also leaves us in a gray area, because some of those people need a stent, and some of those people really it's all calcified, stable hard plaque. which means we want to reduce their risk going further, but their risk for heart attack is very low. And then there's people that have soft plaque in there that you can't really, kind of appreciate. Well, clearly AI technology allows us to take that CT angiogram and literally in 24 hours get a turnaround, and it tells us really, okay, well, where is this person's real risk? So if it's hardened, just like a table, calcified, right? Okay, it's not going to move. And by the way, that's is sign of disease. It is a sign of early disease, but you're less risk. And if you have soft plaque, though, around that is not appreciated, okay, in just a normal status quo CT heart coronary angiogram, it's not really appreciated. And you get it clearly, though, you can really, because they could have a lot of that being soft plaque, which means that they're at risk with exercise, higher blood pressure, go, doing things. Actually, even this is where we get into hormones, man. We give people hormones, we give them nutrients, we give them NAD, we give them supplements that help, basically energy and energy components and get them to sleep better so their energy is good. But what could happen? You're pumping further through that vessel, and here we're encouraging them to exercise and lose weight, and they break off some soft plaque. That ain't good. That's called a heart attack. And again, a lot of people don't survive those. So we have to appreciate this. And this is where that clearly AI technology comes in. So this could save a life, but it also can be very preventative in having unnecessary things done, like a heart catheterization. And that's where then you have to go to cardiology and then you get a heart cath and you obviously have to go down that road. So, and I have seen that. I had a patient years ago, a female, but she had a history of smoking, so I wasn't quite surprised, but I was surprised. Her calcium score, CT calcium score, was over 2,000. Sent her to cardiologist. Cardiology took her right to the cath lab, which is a surgery. It's a diagnostic surgery and there's risks, but took her to surgery. All her lumen were open, unnecessary procedure. There are risks to it, bleeding, actually arrhythmias and death. And even though they're rare and she did fine, it was an unnecessary procedure about 10 years ago. And now with this technology through AI, clearly we can actually take a CT angiogram and give you those kind of results. So just a reminder that we always do the right thing. We live by our core values. We hire and fire by our core values. We love on patients based on our core values, and we do the right thing always. So come join us here at Longevity Health Institute. This is Dr. Lorenz. Be well.